Hey everyone. Today we have the pleasure of talking to Dr. David Brownstein. You all will be familiar with him. We've talked to him before about COVID because he's really been on the front lines of this whole thing. He's a member of the American College for Advancement in Medicine. He's active in numerous holistic organizations. He's lectured internationally about his success with using natural therapies. He's also a prominent author. He's written 16 books, including The Miracle of Natural Hormones, Overcoming Arthritis, Overcoming Thyroid Disorders, and Iodine, Why You Need It, Why You Can't Live Without It. And his latest book is A Holistic Approach to Viruses. Thanks for joining me today, Dr. Brownstein.
Thanks for having me, Tim.
So when we talked before, we concentrated on the phenomenal success you had in treating patients who contract COVID. Today, I'd like to get your perspective on a related issue. So currently it's estimated, and you can correct me if I'm wrong here, but it's estimated that about 10% of COVID patients are experiencing persistent symptoms weeks, sometimes months after having the virus. It seems like there's much we don't know about why this happens, but some research seems to indicate that there might be a connection with previous autoimmune conditions. What are your thoughts on this theory, and sort of generally, what do you see as probable causes for this phenomenon?
Well, the numbers are high for a viral infection and having these persistent symptoms. 10% is kind of on the low side. I've seen some of the studies saying 30% of people having long-term symptoms. Yeah. So, I mean, this is a big deal. And in our practice, we're not seeing those numbers. We're seeing less than 5% having longer duration of symptoms. And the reason I think we're seeing less than that is because we start supporting their immune system from the beginning, and hopefully prior to when they become infected or exposed to it. And certainly if they become infected with it, we use a nutritional and oxidative approach to help support the innate and adaptive immune systems. And I think that allows people to neutralize and dispose of the virus appropriately, and they can move on with their lives. And I do think that this type of approach just makes them stronger, makes them less likely to get these long haul symptoms. I've had a few patients get long haul symptoms. It's not, like I said, less than 5%. And I've been, I think, fairly successful at treating that, with, again, correcting nutritional and hormonal imbalances. It's doing everything. It's doing, cleaning up the diet, encouraging them to drink water. And then, for COVID, just, using, an immune support program and an antiviral program. And, if we give the body its basic raw materials, we're designed to live a good life into old age and have enough energy to do what you want to do into old age, and good brain function to old age. And we're also designed to withstand viral infections. If we weren't, we wouldn't be here after tens of thousands of years on this planet, because we're always exposed to viruses. So I think that this long haul problem with COVID, and COVID in general, and what's happened to our country is just an epitome of our health status. It's just a disaster. Our healthcare system is a disaster. Our health status is a disaster, and our response to COVID has been a raging disaster. And the outcome of that is over 500,000 dead, and too many people suffering long haul symptoms, and yet we're still locked down, at least in Michigan, and wearing masks and social distancing, and COVID's raging here again. So the shorter answer to your question is we continue to support the body. We continue to support the immune system. We use IV nutritional therapies, which has been incredibly helpful for people sick with COVID, and helpful for people who have these long haul symptoms, and getting them out of that. And this in my experience, this approach works.
So if there is somebody listening that has had issues with symptoms that persist long after they've supposedly gotten over the virus, what would you suggest that they do? I mean, what needs to be the first step for somebody who's in that situation and just has no idea where to turn?
Well, the first step is do the basics. Educate yourself on how to support the body and how to support the immune system. And the number one thing is diet. Clean up your diet. Get sugar out of your diet. You get sick with a viral infection, you should remove sugar from your diet, but you should have removed sugar before you got sick from the infection. But if you're there and you've got these long haul things, clean up your diet, remove sugar, remove refined carbohydrates and refined foods. Adequate hydration with water and salt helps. I wrote a book on salt, Salt Your Way to Health, about this. And, then, correct nutritional and hormonal imbalances. I mean, all this stuff supports the body. We do IVs of vitamin C, IVs of hydrogen peroxide, IVs of phosphatidylcholine and glutathione. All these things help, improve mitochondrial function, improve immune system function, improve your ability to make ATP molecules and energy, so you can feel better and, and not be tired and not be brain fogged and, achy and all that stuff afterwards. And our experience with it is much lower rates and much less severe cases of these long haul things than what's reported out there.
I think that's good advice, and I just want to thank you, Dr. Brownstein, for giving us your time and your insights. We always come away much more educated, and I can't thank you enough.
Thank you for having me, and you guys are great. The Alliance for Natural Health is a great organization that really is pushing us in the right direction, and we need to support you guys and keep you there and keep our rights there, because our rights are being taken away too fast and too quickly.
Absolutely. Thank you so much.
Thank you.